Hello, everybody. My name is Katie. For those of you who may be watching this in the future who don't know me, today we're going to present on our case studies. So today's is called Co-occurrence, Overlapping Symptoms, and Understanding Secondary 2. So just some general information about our patient is she is a 56-year-old female Alaska Native who self-referred to audiology for a perceived hearing difficulty. Her medical history includes tobacco and alcohol abuse, an ischemic left middle cerebral artery or MCA stroke in 2021, which was treated with TPA or a medication that dissolves the clot that's responsible for the stroke, for those of you who may not know. And then she also has a current brain tissue bleed, an auditory discrimination and receptive aphasia. This was due to the stroke, and she did go through intensive SLP therapy after her stroke occurred and is currently enrolled in SLP appointments that happen every 2 weeks to every month. But her SLP says she has not attended the last few. She does have active breast cancer, a vitamin D deficiency, lumbar spinal stenosis, and then she also has a history of hepatitis, which is listed as resolved in her chart. So her primary recorded difficulties are hearing numbers, and this goes along with working as a cashier and talking on the phone. So these are all kind of related. Her job is working as a cashier at our local grocery store, and she has a lot of difficulty when people are trying to talk to her on the phone in like giving her phone numbers or prices for things, and she's not able to understand that information. She says she can't hear it good. So, and this is embarrassing for her because she has to enlist the help of her coworkers and she can't be self-sufficient at work anymore. And then the other thing she mentioned was she has issue retaining information. This can be short or long-term information. Some of the primary reported difficulties by her SLP includes auditory input tasks, auditory recall, deficits in understanding pronouns like he, she, him, her, they, it, and then before and after statements, subject and object confusion, and then also discrimination between affricate and fricatives. So here is the original audiologic testing results. These were completed in late 2024 by the audiologist here at North Sound. So otoscopy was pretty normal. Both canals were clear. Her right TM did have some scarring, but both were intact and dry. And then for her hearing loss, she has normal to moderate sensory neural hearing loss in the right ear and then normal to mild sensory neural hearing loss in the left ear. So the PTA does not agree in the right ear with her SRT results, and then she has poor word recognition ability bilaterally, so much so that the right was listed as could not test. However, despite these differences in speech and her thresholds, the test was deemed reliable by the audiologist. And then I did list some TIMP results, which were normal, so you guys could see that as well. We did do an auditory processing test battery with her. In purple, I listed the description of each individual test that was done. For those of you who don't do auditory processing evals often, or for those of you who might be watching this who have not studied auditory processing, those kind of little overviews are listed for you. I won't read them all, but I will go over her scores with you. So for her pitch pattern sequence test, she scored a 10 out of 25 correct in both ears, so that's 40%. The normal for adults her age is 80% in each ear, so this resulted in significant. For dichotic digits, she scored a 15 out of 50 correct, or 30%. The errors were both a combination of her left and right ear, and the normal is 90% correct for both ears, so the results again were significant. Phonemic synthesis test, she scored a 0 out of 25 for the quantitative and a 0 out of 25 for the qualitative. Normal results for adults are 23 out of 25 quantitative and 22 out of 25 qualitative, so both are significant. The other part of our test battery is the scan 3. The first part is the auditory figure ground 0 dB. So this is a signal to noise ratio of a +0. She scored a 2 out of 20 correct in the right ear and a 6 out of 20 correct in the left ear. This was significant for her age, and she does have an ear advantage for 5% in the left ear. And then the scan 3 competing sentences test, she scored a 0 out of 35 correct in the right ear, and then in the left ear, she did get 5 correct out of the 35, resulting in a 5 out of 70 overall. This score was also significant for her age, and then her ear advantage, again, was for the left ear and 10% this time. The filter words test resulted in a 1 out of 20 correct in the right ear, and then a 0 out of 20 correct in the left ear. Raw score 1 out of 40. Again, significant for her age, and then the ear advantage this time is typical for this test. And the last part of the scan 3 we did was the auditory figure ground +8 SNR. So this is where our signal is a little bit louder than the background noise, and can show maybe if the patient would benefit from sort of amplification. So 3 out of 20 in the right ear and 5 out of 20 in the left ear with a raw score of 8. And I did want to point out that this was better than her auditory figure ground 0 in both of her ears. She did have a 5% preference for the left ear again. So I just wanted to note that as well. Okay, so those are the results from her test that we did. Keep in mind questions to think about for next time. What would you diagnose, or what would the diagnoses be? And then what would your recommendations and or treatments look like? Would you want to do any further testing? And then I also have seen this patient a few times, so at our next presentation, I'll also go over how my patient is doing. All right, thanks for attending, and I'll talk to you guys soon.